How to tell if your cat is pregnant. If your cat was recently in heat and had access to an intact, unneutered male cat, there's a chance that she is pregnant. A pregnant queen will display both physical and personality changes that will become more evident around 3 weeks after breeding. The gestation period for cats runs 64 to 66 days. You could consider 63 days or 9 weeks as an average gestation period. Physical changes in a pregnant cat. Looks for these signs in your cat's body indicating pregnancy. Heat cycles cease. This may be the first sign you notice of a cat's pregnancy. If a cat has been going through heat cycles every 10 days to 2 weeks and suddenly stops, it is likely she is pregnant. Nipples swell and become rosier in color. Breeders call this pinking up, and it may be the first visual sign you will see in a pregnant cat. Appetite increases. A pregnant will show an increased interest in food. After all, a pregnant cat is not only eating for herself, but for several fetuses. Weight gain. Most pregnant queens will gain about 2 to 4 pounds of body weight over the course of pregnancy. Vomiting. Pregnant queens may be subject to a few bouts of morning sickness, much as human mothers-to-be. This in itself is not necessarily a reason to worry, but if the vomiting continues or is frequent, contact your veterinarian for help. Enlarged abdomen. Sometime around the 5th week of pregnancy, a pregnant cat's abdomen will start to swell noticeably. It will continue to enlarge until time for birthing. Personality changes in a pregnant cat. These character and mood changes are also indicative of pregnancy. Affection increases. Your cat may become more affectionate than normal and frequently seek out your attention. By all means, give it to her. Increase in sleeping. Many pregnant queens will sleep for more hours in a day than before pregnancy. Clinical diagnosis of pregnancy in cats. If your queen has had regular veterinary care and the previous signs of pregnancy are evident, it may not be necessary to get an official diagnosis from a veterinarian. However, it's a good idea for your vet to examine your cat and make sure she is in good condition. Palpation of the cat's abdomen. Your veterinarian may be able to feel your pregnant cat's fetuses by palpating and gently pressing on her abdomen. This typically happens around the 17th to 25th day of pregnancy. Ultrasound of your cat's abdomen. An ultrasound may detect fetuses as early as the 2nd week of pregnancy, and heartbeats may be detected sometime after the 3rd week. Radiographs. X-rays. Your vet can take a radiograph of your cat's abdomen when she is further along in her pregnancy to determine the number of kittens she is carrying. This is a minor amount of radiation that will not be harmful to the kittens or the mother. Kitten spines and skulls begin to be visible on X-rays after about 42 days into the pregnancy. If your resident or rescued cat is indeed confirmed pregnant, some serious decision-making time is at hand. If you decide to spay her and prevent the pregnancy from coming to term, it should be done as early as possible. If not, be prepared to help care for the kittens and find them all good homes. Signs your cat will give birth soon. Once your cat begins active labor, try to leave her undisturbed. Watch from a safe distance to make sure she does not go into distress. These signs indicate kittens are on the way. Nesting activities. As the birth gets closer, your pregnant cat may seek out quiet, private places for the birth to take place. This typically begins up to 2 days prior to labor, but it may only begin a few hours prior. Restlessness. About 24 to 48 hours before labor, the pregnant queen may seem restless or anxious. She may go in and out of her nesting area almost as if pacing. Vocalization. In addition to the pacing and restless behavior, the pregnant queen may meow and cry out more than usual. Lowered body temperature. Within 12 to 36 hours of labor, your cat's body temperature will drop below 100 degrees Fahrenheit. Normal temperature is usually between 100.5 and 102.5 degrees Fahrenheit. Loss of appetite. Your pregnant queen will likely have had an active appetite during her pregnancy. As she comes close to labor, she will have a drastic decrease in appetite. Vulva licking. As labor fast approaches, your cat will begin licking her vulva to clean a mild discharge. You will likely not see this discharge, as she will want to keep the area clean.